So we'll get started. Let me get the timer going. So I want to thank everybody for being here on the last day, one of the last set of lectures. We appreciate everybody for being, especially at an interactive session. You know, it's the end of the meeting, you're really tired. The last thing you want to do is talk to other people, and I get it, okay? I'm right there with you. When I had visions of this thing being like the first day with tables, right? And we'd all be eager to do this, okay? Unfortunately, fate has intervened, and so we are here with you today. Let's see, how do I move this down? Yes, good. Okay, so we're going to talk about, really about coaching, but specifically for soft skills that are often things that as medical educators and administrators we have trouble working with and facilitating improvement. So with me today is Mike Godley, who's chosen to stay, and we greatly appreciate it, and Sean London, who also, nobody wants to be with him, so he's here with us, okay? And our other two people, Mike Cole and Corey Chumpinzazzi, they are victims of our current status. You know, one had staffing issues in the ED, right? Had to do shifts. The other had a child's birthday party. I'll let you figure out which had which. It doesn't really matter, does it? So we are here today. We have nothing to disclose other than we are truly glad that you are here today. And that's the truth. So what we want to do is just go over briefly, and I want to go as fast as possible, what coaching means in medical education and how we can use it. And what are the relative soft skills that we can use it for, how you use the coaching, and then we're going to let you try it. And that's the main thing. We want you to get a little bit of experience with it. We have 6 case scenarios to try it out with, and we think that you'll gain some insight by just trying out those cases. And then we're going to go over what we learned from doing the cases and really decide, is coaching always the best method for some of these things? Sometimes it is, sometimes it's not. So briefly, let's go through the accepted roles of being a medical educator and administrator. So the first thing is we're instructors, right? We provide information to our learners and to others. We're also assessors. We monitor the performance and progress of our learners, right? And then we're supervisors. We set the standards. And role models, right? We influence how they believe and what they do as professionals. We're change agents, so we're experts, and we can use our leadership skills and our knowledge to help people make decisions. And we're scholars. We apply evidence to what we do. And we're also mentors. We take people, learners and peers, and we help them get to places where they want to go. And we actively take a role with that. And then we're also coaches. We facilitate people's self-development. How many of you have seen the series Ted Lasso? Right? So if you haven't, you really, it's great. It's really a lot of fun. Ted Lasso's a coach. He's a football coach in America, coaching a football team in England, which is a different sport, right? And it's not just about him being coach of a football team. He coaches everybody in that show, like all the different characters. There's lots of different characters. He's always a coach. And you can see by that, sometimes he's coaching people, they respond, sometimes they take longer to respond, and sometimes they don't respond. So coaching isn't for everybody at every time. We want to make sure that we understand how we use it. So let's look at it in a different way with our roles. Like, for example, when we're an instructor, we tell people, here's what you should do, right? So when we're an assessor, here's what you did, here's your feedback. And when we do the supervisor thing, we check to make sure they do things correctly. You know, it's that central line in the vein, right? Role models. If you want to learn how to do a lumbar puncture, watch me do it, okay? Change agent. I support this method to improve our outcomes, and I've really done the work to show that this is going to work. Scholar, here's the best evidence, and mentor, here's what you need to do, and I will help you do it. But coaching is Really, let's understand what you're trying to do, and we'll figure it out one step at a time. Mainly you will figure it out, and I'll help guide you along that journey. So coaching is very similar to other ways to assist, but has a different purpose and different frame of mind. You need to clarify the problem at hand for the person that you're coaching. You need to understand the process that person is currently using to address that problem. You need to listen to them, which is one really hard thing for us to do. We are doers, and we are like, we want this to happen, and we know where we want people to go, and so it's really easy for us to tell things and not listen. And this is always the biggest challenge for me when I coach, is to listen. Asking open-ended questions to reframe the problem. We do a good job of that. So we're trying to facilitate a self-determined and self-directed change within our learners, within the context of a helping conversation. That's coaching. Okay, you have just gotten a 2-day coaching course in about 5 minutes, so you're welcome. All right. So where can we use it? Who can we use it? So skill development. Sure, we got plenty of ways to work on that. Medical knowledge procedures. I think we're all pretty familiar with those things with our students and our residents. But the softer skills, the communication, the professionalism, emotional intelligence, which are really essential when you're working in the emergency department in a team setting with patients you never met before. These are skills that are really important for us to not only assess, but to be able to address when there are challenges for our learners, right? And then career advising. If any of you have graduating residents or residents that are about to graduate, you know there's a lot of concern about jobs and what to do. So coaching helps with that as well. Does that resident really need to do a fellowship? They want to do a fellowship, but I'm like, okay. Think about it. And then wellness is the other one, okay? So when we look at faculty, staff, similar things, career advising, wellness, right? But when you look at skill development for faculty, it's obviously different than it is from students and residents. So mainly for teaching techniques and how to improve those, and assessment, why you don't just want great job written in the assessment, right? And explain how useful that is, right? It's not useful, we know that, but faculty need to learn it. And then those soft skills we talked about earlier. Some faculty have those developed, some need some work. We all kind of need work on it. And then when new roles come up, so a lot of new faculty roles have people in similar roles to act as mentors. But what if you have a new role for someone where there isn't someone who's actively could be a mentor, like a new program director or a new vice chair? That needs some coaching from somebody to help. Okay? So there's roles for it, and here's how it's done. Very easy. Understand the relationship between the coach and the coachee. What's the goal of that coachee? What's the goal of the person you're trying to help, right? We want a SMART goal, right? You know the acronym? Specific, measurable, attainable, realistic, and timely. So we don't just use it because it's there. We use it because it creates commitment. It creates commitment on the person who's being coached to follow through with what's happening during your coaching session. Okay? What's been done up to this point? We want to know what the person being coached has done to deal with the problem at hand so we don't repeat stuff. And then what are they thinking about doing? Maybe they already have some good ideas and know they just need some validation for that, okay? But you want them to commit to a new plan when you're in and done, okay? So we already talked about the soft skills in the emergency department that really would lend itself to coaching. And we know that other methods of teaching these soft skills have limitations. Formal lecture, testing, don't really work. You can utilize tools that you have to find out who needs coaching, such as Press Ganey for your faculty. Take the ones that are doing really well, and maybe they can coach the ones that need some help. But the other thing is when somebody finds out, like they get some bad news, like they didn't do so well in the in-service, where their Press Ganey's low, that's the time to use some coaching. That's the time to offer them some encouragement and say, we can get you better. Let's work on this, and we can do this. So let's coach. So I'm going to ask our esteemed colleagues here who've been silent to distribute our cases. And we have 6 cases that we're distributing. And all we ask is that you pair up with someone who doesn't have the same case you do, so you can each try a case, okay? So we have case 1 is a resident case, and these are all based on experiences by our group. So these are all based in fact. Case 2 is another resident case. Case 3 is a faculty case. Case 4 is a very interesting resident case. Case 5 is a student case, and case 6 is a faculty case. And we'll go over each one after you guys have had a chance to do it. So what I'm asking you to do now is find a partner in crime, and what I'd like you to do is each one of you take 10 minutes. One of you will be the person being coached, and you'll follow the role in the case and really ham it up, okay? Make it as difficult as possible for that person you're pairing with, okay? This is your opportunity to really kind of try this stuff. We'll time it for 10 minutes, then you'll switch and you just change roles. So the person who's coaching becomes the person being coached and you use that case that you have, okay? Questions? We're all advanced degree people here, right? So we understand this? Okay? Cool. So you can just kind of share the outline with it in terms of like, so to introduce the case, just let them know the scenario briefly. Just let them know the scenario briefly from your case, so that they understand the context. Should have said that.